Interpreters, please begin.
Thank you so much. Muchas gracias. Hi, everybody. Good afternoon. My name is Dalis. I am here with my co-interpreter, Irwin, and we are here representing Tilde Language Justice Co-op. And Irwin and I will be your Spanish-English interpreters today. We're going to be interpreting this session from English into Spanish and Spanish into English using the Zoom interpretation feature that will be turned on in a few minutes once I'm done with this introduction. We're also very happy to be working alongside our colleagues, the ASL interpreters today. Hola, buenas tardes a todos. Yo soy Talis. Estoy aquí con mi cointérprete, Irwin, y venimos representando a Tilde, la Cooperativa de Justicia del Lenguaje. Y Irwin y yo vamos a ser sus intérpretes del inglés al español y del español al inglés. Vamos a estar utilizando la función de interpretación simultánea de Zoom, que va a ser encendida en un momento en cuanto yo termine esta presentación. Nos da mucho gusto estar trabajando hoy junto con nuestros colegas, los intérpretes del lenguaje de señas americano. To access interpretation, and this is going to be for everybody who is not fully bilingual in English and Spanish. If you're not quite fluent in Spanish, you're going to want to join the English channel so that you don't miss anything that's said in Spanish during the call. And you'll be able to do so in a moment when we turn it on. There will be a little globe that pops up if you're here through a computer. There will be a little globe at the bottom center of your Zoom screen that says interpretation. You'll be able to click that and then select the English channel. And if you're not seeing that little globe, or if you're here through a smartphone or a tablet, you can click on the three little dots at the bottom right corner of your Zoom app, the three dots that say more. And there you'll be able to select language interpretation and once again join the English channel there. Para acceder a la interpretación simultánea al español, para todas las personas que o no sean bilingües en inglés y en español o que simplemente prefieran escuchar y participar solamente en español, para usar solo español, en un momento cuando se encienda la interpretación, van a poder ver un globito en la parte inferior en medio de su pantalla de Zoom que dice interpretación. Pueden hacer clic ahí y ahí pueden entrar al canal de español. Y si no ven ese globito o si están aquí a través de un teléfono inteligente o una tableta, pueden hacer clic en los tres puntitos que están en la parte inferior derecha de su aplicación de Zoom, los tres puntitos que dicen más. A veces hay que recorrer la barra de herramientas un poquito para encontrar esos tres puntitos. Y una vez que hacen clic ahí, pueden seleccionar interpretación de idiomas y de nuevo ahí pueden entrar al canal de español. Just a reminder today to please speak at a moderate pace and taking breaths and taking pauses, just so that we're able to follow along and interpret your full message. Y un recordatorio a las personas que estén hablando en voz alta el día de hoy de por favor hablar a un ritmo moderado, tomando pausas, respirando, para que les podamos seguir el ritmo e interpretar su mensaje completo. Lastly, if there are any issues with interpretation, please let us know through the chat and we will do our best to help you out as soon as we can. Por último, si hay algún problema con la interpretación, por favor díganos a través del chat y les ayudaremos en cuanto podamos. Thank you so much. We're ready to turn.
Oh, thank you. Next slide, please. Okay. So, well, good morning or afternoon, wherever you are, and many thanks to our interpretation team. Welcome to today's office hours, which is an event co-hosted by the National Resource Center on Domestic Violences, Capacity Building Center on Safe and Supportive Housing, and STARS, the Indigenous Safe Housing Center. My name is Brittany Eltringham. You can use she, her when referring to me, and I'm the Director of Safe Housing Initiatives at NRCDV. I am a 30-something Native Hawaiian woman with today long, straight brown hair and a brown shirt on, and I have a blurry background behind me. We'd like to review some brief housekeeping notes with you as folks have communicated about our language access. This event features closed captioning. In the meeting controls toolbar, click the show captions icon and you can access captions in English. We aim to make this a mixed ability and multilingual space, and this takes everyone's commitment and effort to make a reality. Please submit your questions using the Q&A feature. Please send comments or resources directly to the event hosts. We'll read the questions or comments aloud so they can be interpreted. We may not have the ability to answer questions submitted in Spanish in real time, but we'll review and provide follow-up as our capacity allows. And while we aim to make this a mixed ability and multilingual space, we also know we're still learning how to do this well. So please reach out to me or other event hosts during the webinar if you're experiencing any issues. We'll also ask about accessibility in our post-event evaluation. So please let us know your experience and any ways that we can improve. We know we have a lot to learn. We're recording today's event and it will be available on our website and YouTube channel as soon as possible. And I mentioned something similar, but if you're experiencing any ongoing technical issues, please reach out. But please note we may have limited capacity to resolve those issues while the event is live. Briefly, in today's office hours, we're going to discuss creative ways that ARP funds can be used to meet survivors' safe housing needs. We're talking about the ARP funds from the 2021 American Rescue Plan Act, which provides millions of dollars that remain available until expended through September 30th of this year. Gwen Packard, the director of STARS Indigenous Safe Housing Center, will share some lessons learned from the National Workgroup on safe housing for American Indian and Alaska Native survivors of gender-based violence. We at NRCDV will share our recently published infographic, which includes key ways that ARP funds can be utilized to meet urgent housing needs of survivors, but primarily, this is going to be hopefully pretty interactive. We'll come together and move through some scenarios, which I know is everyone's favorite, but we're not making anyone get into breakout groups, so bear with us. Really, we want to hear your questions and talk through creative ways for utilizing those ARP funds. I think with that, I can pass it along to Gwen and we can advance the slides. Thank you.
Great, thank you, Brittany. Hello, everyone. I'm Gwendolyn Packard, Ihangtawan Dakota, and a survivor of domestic violence, coming to you from Omaha, Nebraska. I'm an older Indigenous woman with shoulder-length silver hair, reading glasses, and a STARS theme behind me. I'm currently the director for STARS, the Indigenous Safe Housing Center, a project of the National Indigenous Women's Resource Center, dedicated to addressing the critical intersection of housing instability, homelessness, and domestic violence among American Indian, Alaska Native, and Native Hawaiians, and in tribal communities both on and off reservation. STAR stands for something. It stands for safety, training, technical assistance, resources, and support. STARS strengthens advocacy and support for Native survivors by identifying and challenging systemic barriers and expanding access to safe, stable, and culturally appropriate housing. The need for safe and affordable housing is one of the most pressing concerns for American Indian and Alaska Native survivors of domestic violence. 50% of the homeless population identify domestic violence as a primary cause. A significant number, anywhere from 22 to 57% of homeless women, report that domestic violence was the immediate cause of their homelessness. Survivors also often remain in abusive relationships and living environments because they have nowhere else to go. They don't want to be unhoused with their children. The rates of violence against Indigenous women are more than twice the national average, and in some cases 10 times the rate of non-Native survivors. 92% of homeless women have experienced severe physical or sexual abuse at some point in their life, oftentimes on the streets or in homeless shelters. 63% of unhoused women have been victims of domestic violence. 38% of domestic violence victims will become homeless at some point. And sexual assault is both a precursor to and a consequence of homelessness. And of course, we can't ignore the documented connections between child welfare and housing. There are many barriers to safety for American Indian and Alaska Native survivors, such as the jurisdictional maze that so many Indigenous survivors experience. Invisibility, often our stories are not heard. There's a serious lack of direct services and resources for survivors. And the availability of housing on tribal nations is just not there. Waiting lists for tribal housing can be just as much as those for housing vouchers. Lack of access to adequate health care and behavioral health services, including lack of treatment facilities for substance use and mental health issues. Many tribal communities grapple with extreme poverty and high rates of unemployment. And there is often inadequate law enforcement responses, with many tribal enforcement departments inadequately staffed and equipped to respond to the needs in our communities. For the domestic or sexual assault survivor, access to safety means access to shelter and housing. Without adequate housing on tribal lands, victims are often forced to leave their ancestral homes and place of significant cultural meaning. Oftentimes, they have to leave their tribal community, which can resemble removal. Oftentimes, they enter non-tribal shelters or shelters that cannot address their needs on a peer-to-peer basis and lack cultural relevance, or they return to their abusive environments. STARS is built on a human rights framework and lifts the voices of survivors and those with lived experience while centering Indigenous lifeways throughout the housing spectrum. STARS looks at housing through a domestic violence lens and an Indigenous lens. Housing stability and access is an ongoing crisis in Indian country, both historically and presently. Family and community is central to Indigenous people, and many Indigenous people reside in multi-generational homes. There are 574 federally recognized tribal nations, and FVPSA funds almost half of those and has funded them for many years. FVPSA has been the bread and butter for many tribal domestic violence programs and shelters as the main source of funding for these initiatives. Despite the high rates of violence in American Indian and Alaska Native communities, nationally, there are fewer than 50 tribal domestic violence shelters. And there are many states with large Native populations that do not have a tribal shelter. In FY22, STARS received ARP funds and used the lion's share of this funding to provide subawards to tribal domestic violence programs and shelters that do not have FVPSA funding to address the tremendous unmet need in the country. We provided funding to 20 organizations that assist tribal domestic violence survivors by providing supportive services, shelter options, and supplies to reduce the exposure and risk of COVID-19. And since we are a housing capacity building center, STARS funded organizations that provide housing provisions, including assistance locating and securing safe and affordable permanent housing and homelessness prevention services. Rental subsidies, including housing application fees, temporary refuge or lodging, supporting safe home operations, hotel or motel vouchers, transportation, childcare, job training and employment services, including life skills training, shelter operating expenses, community outreach and awareness activities, addressing disaster or emergency preparedness for tribal domestic violence programs and shelters, and supporting the needs of domestic violence programs to respond to survivors in their communities, such as safety planning during a pandemic, mobile and remote advocacy, and promoting staff wellness during a public health emergency. Funding or subawarding funds was a new experience for STARS and for the National Indigenous Women's Resource Center. So we did experience a delay in a startup in activities. At a recent gathering of NIWRC and STARS grantees, those funded organizations expressed what an amazing opportunity it was to have the resources that they hadn't had before to do the meaningful and important work in their communities in addressing safety, shelter, and housing to survivors. Thank you for this opportunity to share information about STARS.
Thank you so much, Gwen. I want to remind folks that while we have limited use of the chat, we welcome your questions in the Q&A box. And if there's anything that you would want to communicate to us that we can read aloud to everyone, please do. We can also welcome folks to unmute themselves as well. We just want to make sure that we capture these comments with our interpreters. And I think with that, we can move into sharing our ARP document from NRCDV, and we won't take too long on that. We want to shift pretty quickly into the scenarios and conversation with you all. And please, if anything comes up that you are willing to share in the chat, your experience with spending down ARP funds in your community, please send it our way. Drew, if you could stand up that other document. And I'll welcome Sheena onto the screen.
Thank you, Brittany, and thank you so much, Gwen. Good afternoon or good morning, everyone. My name is Sheena Morris. You can refer to me with she, her pronouns. I am the Vice President of Policy and Systems Change at the National Resource Center on Domestic Violence. And I'm excited about you all joining us today for these office hours. I am wearing a burnt orange sweater, a white shirt. My hair is braided back in 2 braids, and I have on blush pink glasses just to provide you with a little bit of information of how I'm showing up today in appearance. So just wanting to take a little time to talk about some of the familiar ways that ARP funds can be used to support survivors' safe housing needs, but also maybe take a little bit of time to talk about some of the ways that may not be so evident in the ways in which people can use ARP funds to support survivors' safe housing needs. As you've heard from our partners at STARS, safe housing or housing is essential to survivors' overall safety. And so with that, the ARP funds really gives us an opportunity to really set a strong foundation in supporting survivors' safe housing needs. And we know that these funds will essentially be sunsetting at the end of this fiscal year. And so we want to do all that we can to maximize their use in meeting survivors' safe housing needs. So just to introduce the technical assistance product that NRCDV has developed, which you see here on the screen, and talk through a couple of ways that the funds can be used. Most of you all, I understand that we have several coalitions on the call with us, some government partners. My assumption would be state administrators to some degree, as well as advocates and other helping individuals on the call with us today. So that means that many of you all may be familiar with the fact that ARP funds can be used for rental assistance in providing safe housing. The one thing that we wanted to make sure we noted on this document was in providing rental assistance to survivors, to be sure to have clear policies and organizational guidance in order to administer this type of assistance. That is critically important, that the policies be clear so that individuals and organizations understand how to administer rental assistance through the use of these funds. But some of the other things that may not be so easily or readily thought about with the use of ARP funds are things connected to, say, the home setup. So the housing has been secured, but now what does it look like for the survivor to actually settle and get into the home? And so think about the ways of using ARP funds to purchase things such as air purifiers in the home. As the survivor and the survivor's children or family is now settling in the home, we know that they may have visitors in the home, depending on case plans or things of that nature. They may have, appointments that are set for home visits, and be engaging with people that they may not also necessarily always be so familiar with, or there may be different people coming and going. And so air purifiers is one of those ways. Again, all of these fundings being provided in the context of mitigating COVID and being responsive to public health emergencies. Air purifiers may be one of those things that this could be a good time to secure for survivors in their housing. These funds would be opportune to purchase things such as those. Another thing to consider is for programs or organizations who are providing congregate shelter, think about the non-congregate common areas and how those areas may be set up or how they may need to be upgraded. What are the lessons that we learn from COVID-19, the pandemic, and being in spaces with each other, creating those distancing spaces. So think about the ways in which these funds could be utilized to create those outdoor common areas, and what supplies may be necessary for those areas to be more responsive to public health emergencies. So just to kind of get your wheels turning a little bit on some of the ways to use these funds. We also know that a number of programs and organizations have begun to implement or explore mobile advocacy. And so think about some of the ways that ARP funds could essentially be used to set up your mobile advocacy program. What case management supplies or equipment may be needed? Is this a good time to also equip your mobile advocate with things such as testing supplies that they can give out to survivors, or cleaning kits that they can leave behind with survivors for their homes? Also, just thinking about any type of toiletry stockpile that the mobile advocate can provide for the people that they may be serving. Again, other creative ways that may not always be so commonly thought of when we talk about the use of ARP funds and meeting survivor safe housing needs. And then also thinking about congregate shelter design or the floor plans in general. Again, what are some of those lessons that programs, organizations, particularly in a shelter setting, may have learned from the height of the COVID-19 pandemic and needing to distance in various different spaces? So as these funds sunset, it may be a good time to engage in some consultation on best practices or what needs to maybe be improved in a particular shelter building. How does the layout perhaps need to change in order to provide more flexibility and distancing in a time of an emergency? It's also a great time to engage in being very responsive to the needs of survivors with disabilities. So thinking about the ways that you can bring some of the features up in the shelter that may concern grab bars in bathrooms or entrance ramps, things of this nature, how to make the space more accessible. So these are just a couple of ways to think about utilizing, again, these very time-sensitive funds to meet survivor safe housing needs. And with that, I'll pass it back over to Brittany to go take us through a couple of more examples.
Thank you, Sheena. Again, this is Brittany speaking, and I know a lot of this information has been said, so I'll try to move through this pretty quickly. I also want to acknowledge that I know a lot of this information is available in the program instructions that programs were provided. If you go to page 16, I believe, in one of the documents, there is a really detailed list of allowable use of funds. But again, going back to maybe some of these things that folks maybe hadn't considered. Again, we've mentioned, and this is something that Gwen mentioned, they made good use of with their disbursement of ARP funds, but COVID tests, masks and gloves, other cleaning products and cleaning equipment, toiletry, pantry items, as you can see here on the screen, menstrual supplies, hygiene and wellness products. But some of the other things that we also wanted to encourage folks to think about, because this is, we know that this is all in the spirit of prepare, prevent, and respond. And so a lot of this had to do with what was the impact on advocates and maintaining essential services during a public health emergency. So other things to consider include wellness funds for over-the-counter and prescription medication assistance, housing application and deposit fees, sick visit fees and copays that are non-reimbursable, survivor stipends to engage in participatory congregate shelter design or assessment activities, as Sheena just mentioned, prepaid utility services and programs, as well as transportation stipends. Oh, I think I'm being encouraged to slow down, so I will do that. And if we could move the screen a bit. And lastly, some other things, because, a lot of this is about helping survivors maintain that housing. So childcare services, credit repair services to aid with securing safe housing. And maybe something that folks haven't considered is the provision of remote employment setup. So the equipment that might be needed to make that more possible. I think that's all we have here on the list, so we can pull this down from the screen. Again, I'm going to share a link to the allowable use document as well, because I think there's some really great information in there. But at this point, we just want to kind of turn it over to you folks. What are you experiencing in your communities? What questions do you have? Yeah.
This is Sheena speaking, and I think we invite you to pose your questions in the Q&A. We invite you to come off mute if you have specific questions, as well as leverage the chat if that is easier to pose a question.
I also want to welcome that if you don't have questions and you have suggestions, this is a great peer-to-peer opportunity. So really, truly, the floor is yours. And if you do want to stay anonymous with any of your questions, please feel free to just message me directly. We can read your questions aloud.
While folks maybe marinate, as I like to say, a little bit on some of the things that we've shared thus far, and this is Sheena speaking, how about we maybe dive into a couple of scenarios and then give some pause to see if folks have any questions or reflections?
Sounds good. Turn it over to you, Drew.
Thank you. Thank you. Hello, my name is Drew Bowling. My pronouns are he, him. I'm the Senior Program Specialist at the Safe Housing Initiatives at NRCDV. I'm a 40-something white, light-skinned man with shoulder-length dark brown hair. I'm wearing dark rimmed glasses and I have a dark brown mustache. I'm wearing a black button-up shirt with a collar, and the shirt has red polka dots on it. As Sheena and Brittany mentioned in this next section, I'll be sharing some scenarios that service providers may encounter when assisting survivors of domestic violence. I'll read the scenarios out loud, and the text of the scenarios will also be shown on the slides in English. Just one note about that, I want to apologize for only having these slides in English and not having them simultaneously in Spanish as well. And one thing I want to mention before I begin the first scenario, I'd like to remind everyone of the non-discriminatory requirements in the Family Violence Prevention and Services Act, or FVPSA, about providing services to all survivors regardless of their background. We will provide a link in the chat to the Code of Federal Regulations that describes the provisions for FVPSA-funded programs. But in summary, FVPSA requires that all survivors be provided services regardless of their actual or perceived sex, including gender identity, regardless of the survivor's religion or religious belief, and regardless of the survivor's sexual orientation. FVPSA grantees should also create a plan to identify and communicate with individuals with limited English proficiency, or LEP, and all FVPSA-funded services must be provided without requiring documentation of immigration status. With that, I'll just read the first scenario. Tabitha is a mother with 2 children who recently signed a lease to move into a 3-bedroom rental home. This is her second time trying to maintain safe housing away from her partner who was abusive. Although she is currently employed, she is concerned that sustaining everything will be challenging in the first few months as she tries to build her savings back up and cover housing and basic needs for herself and her children. Economic instability in the past has caused Tabitha to return to her former partner, including most recently during the COVID-19 stay-at-home order. What may be some of the household expenses your organization could support her with? Is it allowable for you to use your ARP funds in providing a 6-month prepayment for electrical utilities? And again, as has been mentioned previously, we have multiple ways that you can chime in with your ideas or suggestions, either via the chat, the Q&A, or you may also unmute yourself to just offer your suggestions that way too.
So maybe want to start with that first question. Drew, this is Sheena speaking. Are there any thoughts or ideas on some of the ways that household expenses, your organization could support Tabitha with any household expenses? And this may be a pretty low bar, easy one. This is Sheena speaking. I'm seeing some chiming in the chat of cleaning supplies, linens. That speaks back to that setup piece that we talked about in the document. Other thoughts?
Sheena, I just got a question from someone. What about security systems for the home? We've had a question about this before.
I think security systems is one that can be a little bit complex, right? There is the installation of the system, the one-time cost, the setup cost, that I can double check, and we can circle back with the response, of course, but I feel pretty sound in saying that that would be an allowable cost. I think it would be the reoccurring expense of the monthly bill, which may be the thing that is a bit more tricky and perhaps something that is unallowable. However, we will capture this question and we will absolutely provide a follow-up response that is concrete for you post office hours.
Sheena,
Right.
if it's helpful for me to confirm this at all, we did talk about this at length once, and I can confirm that the part that it can't be used to pay for is the monthly service. And there was a reminder of if the cost is over that $5,000 threshold, additional steps would need to be taken before approval of the purchase could occur. But the cameras would be the property of the grantee. And with
That's right.
the grantee would be expected to keep an inventory of the cameras.
Thank you, Brittany. I do recall this question coming up for us before. Now, when you said cameras, you're absolutely right.
Yeah.
I'm also seeing a couple of things in the chat about grocery store gift cards. So food pantry setup is what I'm taking away from that. Is there anything else?
From Paloma, someone mentioned, I believe that yes, you can use the ARP funds for prepaid electrical utilities. The electric bill would be an allowable expense as long as paid to the vendor directly, as this would support housing stability. Other expenses would be cleaning and household supplies to help her set up household. And I'm also getting a couple of responses from my co-panelists because the chat is disabled and we're in a meeting. We're all just getting individual messages. So Drew, if you got a response from someone, hop in. Gwen, if you get a response from someone, hop in. Kim shared through TechSoup, programs can request a donation of Ring security systems for survivors. It is something that is renewed and there are limited numbers available each year. Thank you so much. Again, I also want to remind folks, please feel free to come off camera. Raise your hands, we'll pull you up.
Yes, it sounds like the creativity is waking up. All right. Do we think we want to move maybe to the next scenario? And Plum, I want to give you a shout out for the utility assistance question response. Yes, 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 yes.
Yeah, we can move on. Okay, scenario 2. Jonathan has finally returned to working in the data entry field. During the COVID stay-at-home order, he was experiencing escalating violence and was forced to flee his relationship of 15 years. After getting settled into new housing, he is rebuilding his career and recently secured a 12-month remote employment contract with a data entry firm. Can you use your ARP funds to assist Jonathan with purchasing equipment and office setup?
I'm getting a yes from my end of the chat. This is Sheena speaking. I'm seeing a yes. Also, I can only, oh, that probably is not part of the message, Sharif. Yes. We're just good. Yes, period. That's it.
I also remain curious if folks have any experience making any of these purchases, would love to hear from you folks. But it sounds like this one was pretty cut and dry. Okay.
Yeah, we can move on. This is Drew speaking again. Scenario 3. Since the COVID-19 shelter-in-place order ended, there has been an increase in the number of survivors with immune systems compromised by the effects of long COVID who are coming to stay at the shelter. Many of these residents have expressed concerns about health risks involved with staying at shelter, specifically with exposure to airborne germs and infections. What are some possible plans or modifications that you could consider with ARP funds to improve accessibility at the shelter?
Purchase of air purifiers, I'm hearing, sanitizing supplies and disinfecting supplies.
This is Sheena speaking. I had a similar response to show up in my chat to what you just shared, Brittany, and it was referenced as health stations, cough drops, masks, and other things as well.
Yep. I also got, and I'm glad this person said this because this was going to be my next comment. So in addition to sort of air purifiers that you can stand up in spaces, there's also HEPA air filtration systems. Kim mentioned they have whole unit ones or room ones, and you can buy additional filters, which I think is a fantastic idea for when funding ceases, so that there's a supply to last for a year. You know, I keep getting emails from somebody who is trying to sell me retractable, portable medical. I'm missing the word. Medical screens. Thank you. I knew I wrote it down. But you know, those might be things to consider so that if you have, you know, a congregate space and you need to set up privacy, you know, I won't promote his product because I can't verify it, speak to it. But that is an option as well.
This is Sheena speaking. Speaking of private spaces, one of our participants also mentioned having an outdoor area for people to opt into having dinner at when they maybe need to be unmasked. And again, we know that the use of mask, comes and flows with the public health emergency, everyday cold, there are various different ways we can engage in mask use. So having some type of outdoor space just to be away and to be able to have, your dinner unmasked, that's a good idea as well. Yes. I want to take a minute to pause also and to ask Gwen if you have seen some of these type of solutions come up in working with and engaging tribal survivors and tribal organizations in the spending down of these funds, or are there other creative ways that you've heard of folks using those funds based off of some of the scenarios that we've done so far?
I know that early on during the pandemic, there were some really creative ideas that had come out, like purchasing see-through shower curtains. This is kind of like those medical things, retractable medical things you were talking about, Brittany, to kind of section off places. And also since a lot of the advocates do provide some transportation services, they were putting them in the cars to separate the front from the back as another added layer of protection. Was one I had seen earlier that I thought was really genius. In fact, the Tribal Coalition had purchased a number of those for the tribal programs in their area to use to help isolate and for containment issues. I think some of the other things that we've seen are the one that we saw that I thought was really different was someone had asked if they could use the funds for to get their cat vaccinated, to get their cat the shots that they needed, because the shelter would allow pets in, but they had to have their shots, their vaccines. And so as a condition of being accepted into the shelter. So that was something that I hadn't seen before or heard of before, but that was certainly an allowable cost because it made a difference of them being able to stay with their pet and also to access shelter.
Thanks, Gwen.
This is Drew speaking again. And I think what Gwen just said is a very good segue into the next scenario Oh, we
Hold
got
on
one
real
question.
quick before you move ahead. I got a question from someone who unfortunately can't message Gwen, but asked, Gwen, do you have any advice for suggestions to reach out to Native survivors when we don't have a reservation in our state? They mentioned knowing that not all Native Americans live on reservations, but if you have any recommendations.
Yeah, one of the things that we always, although there's not a tribal nation or a federally recognized tribe in every state, there is in the majority of the states. However, in those states where they don't, there's often Indian centers, which is kind of like Illinois, for example. There's not a reservation there, but there is the Chicago Indian Center, which is a large gathering place. Same with I think Ohio, Indiana, some of these other states where there isn't a reservation, so to speak. There is Indian centers that have been there and been established for many, many years. A lot of them over the years have become health centers to meet the healthcare needs or off-reservation relatives. So there's always that, but there's also, I think almost every state has an Office of Indian Affairs. And oftentimes finding who that is, they can put you in touch with, what some of the tribal or Indian organizations are in that state. And also you can reach out to us because we have a lot of that information as well. If you need help in your particular state with outreach to tribe to Indian people, we're here to help with that as well.
Thank you, Gwen. Thanks for the question. Sorry, back to you, Drew.
No problem. This is Drew again. I was just eager to connect the dots. This next scenario 4, Esmeralda and her partner, like many during the shelter-in-place orders during COVID, adopted a dog to live with them in their one-bedroom apartment. Since then, Esmeralda's partner has become abusive. Esmeralda recently called a DV shelter hotline to ask for help in leaving her partner. During the assessment interview, Esmeralda said she is ready to escape from her partner, but would need to be able to take her dog with her when she leaves, because her abusive partner has threatened to kill the family's dog if he finds out that she's trying to leave him. Esmeralda said she's already attempted to apply for rental assistance through her city's program, but she was told that she is ineligible because she doesn't have a pending eviction order filed against her. The DV shelter, however, does not have space for the pets of survivors who come to stay at the shelter. What possible assistance with ARP funds could you offer Esmeralda that will help keep her and her dog safe from her abusive partner?
This is Sheena speaking. They started rolling in before you could get the last words out of your mouth, Drew. So we have that coverage of hotel rooms could be provided as a temporary solution, even though, it may not be a long-term solution. So that is one. What else are we thinking? Especially with the pet.
Hi, Sheena. This is Clarice. If I can just add in really quickly an idea of programs. Some programs are using ARP funding to kind of develop and secure, I would say, dog bed nights in certain animal shelters in our community. They have a contract set up so that way, if the shelter program needs that assistance, they already have that safe space for their pets held by using the funding there. They have a kind of like an MOU or a contract set up with the places that actually house the animals for them. Just an idea.
Thank you, Clarice. I love that. Love that. You said it was called pet bed nights?
Yeah, so it's kind of like, it's basically like a shelter for pets. And I'm not sure. I'm sure there's a lot of other places in, different communities that have something similar. It's kind of like boarding when you go out of town, boarding your pets. But a couple of the shelter programs here actually have like a safe haven for pets that specifically work with domestic violence shelters and house their pets for them while they're in the shelter.
That's fantastic, Clarice. Love to hear it. I know someone had asked a question in the chat that spoke to this. Melissa, did this get to your question at all?
Yeah, so that I asked like a dual question, which you guys cover the pets part, which is phenomenal. But one issue I see, at least in my area, it's a kind of a big county, is we have a shelter, but it's often full. So survivors contact us, do everything that they're supposed to do, but we don't have the space. Even if they don't have a pet, we don't have the space. Would this funding pay for like a short-term hotel just if they don't have a pet, like if there's just no space for them? Okay.
Yes, this is Sheena speaking. Melissa, if I heard you correctly, you're saying the person doesn't have a pet. They are trying to flee. The shelter does not have space. So the alternative could be the hotel motel voucher, or if you all have rapport with a temporary housing, like a scattered site, and they have an apartment that's set aside. Yes.
And before we hop on to the next scenario, Kim, if you keep dropping such good stuff in the chat, I'm going to invite you to come off mute. But she mentioned that some animal shelters have a foster system for domestic violence and sexual assault survivors in shelters where the pets can stay and still be visited by their owners.
And one more too, this is Sheena speaking before we bump to the next one. We had a question come back about paying for the immunizations that may be required for a pet to get into shelter or an apartment. And it sounds like, based off of what Gwen was sharing, some of the ways they've seen tribal coalitions use funds or tribal organizations use the funds, yes, that would be an allowable cost. All right. You all have some great ideas. I love it.
Okay, this is Drew again. Scenario number 5. Norma is a 38-year-old woman who recently came to stay at your DV shelter after finally escaping her abusive husband. She has been married to her husband since she was 16 years old. Because she was married at a young age to her husband, she has never been allowed to work, has not been permitted to learn how to drive, and has no identification or documents of her identity, such as a social security card or birth certificate. Norma said she tried to apply for some COVID-related emergency rental assistance to begin the process of moving out of the shelter and on her own, but her application was not accepted because she wasn't able to provide any identifying documentation. How can you use your ARP funds to help Norma begin to collect the documents she needs in order to establish herself?
This is Sheena speaking. Yes, I'm seeing coverage of documentation application fees, such as at the motor vehicle MVC. Ooh, the C is escaping me at the moment. And at the county vital stats office or state's office. Commission, thank you. Motor vehicle commission, thank you. What else? What other thoughts come to mind? Yep.
Or if she doesn't drive, to get a state ID. it costs to get a state ID.
She should also be able to, the program should also be able to help her pay for her documents so she can get up and going. So that is definitely an allowable cost since there would be domestic violence issues, since domestic violence is involved.
This is Sheena speaking. I think this one is pretty like far reaching too, or intersectional, because we know that by is it Norma? By Norma securing their documents, they'd also be able to access healthcare services, because documents are needed for those type of services, right? And the healthcare services are a allowable supportive service under FVPSA, right? Or if Norma was interested in seeking a particular or any type of employment, often documentation is needed for employment. So you can kind of see the ways in which helping Norma get the documents that she needs gathered not only supports like directly the safe housing, but also her ability to access other services.
I also had a response from someone who, responded similarly. The fees associated with obtaining a certified copy of a birth certificate or to get an identification card are allowable. It is also allowable if they need to have a class to obtain their driver's license. And not to get us too off course, but I've gotten a couple of questions about this, so I did want to mention. We're talking about the American Rescue Plan funds. So yes, these were grant funds that came with the passage of the American Rescue Plan Act in 2021. So today, we're talking ideally to people who have already been granted these funds and are looking for ways to spend these funds down ahead of the September 30th due date. And so I don't think you'd be, we're not talking necessarily about applying for these ARP funds now. But there might be an entity in your community that was awarded these ARP funds, still trying to spend them down. I will put a link in the chat to a place where you can look through the program instructions, list out who received these awards. And if you look for your state, you should be able to at least find some information that can help you figure out who to talk to. And we're also available for follow-up after this conversation as well. So sorry about that. We can move on to the next scenario.
Just one more thing I wanted to say about this one. Since she's never worked, funds could also be used for job training or, to work readiness, so to speak, to help prepare her to get into the employment, to seek employment and to take care of herself.
Thanks, Gwen.
Okay, this is Drew again with scenario number 6. Since the 2020 shelter-in-place order due to COVID-19, a DV shelter has seen an increase in survivors seeking shelter who have limited English proficiency. I do want to interject here, and this isn't on the slide. This scenario involves providing services with a survivor with limited English proficiency, or LEP. And I just want to take a second to say that LEP refers to someone for whom English is not their primary or proficient language. So for example, someone who is deaf or hard of hearing may primarily use American Sign Language to communicate and therefore might have limited English proficiency. Additionally, someone who has immigrated to the United States from a country where English is not the official or primary language may also have a limited English proficiency. Back to the scenario. Before COVID, many of these survivors worked in the service industry and were more accustomed to inquiring about work in person. Since the shelter-in-place order has ended, however, Many of these employers now want work inquiries to only be submitted online, and most of those job opportunities are only in English. In what ways could ARP funds be used to streamline and strengthen the language access of all survivors at the shelter?
I have offering ESL classes or tutoring services. What else do we have coming in?
Someone said interpretation, translation. Someone said digital translating services through a screen or iPad.
This is Sheena speaking. This may even be a time where, similar to how we were thinking about some type of assessment or organizational assessment to be able to improve the delivery. This may be even a good time to think about using these funds to engage in that. What are the ways that we can strengthen our LEP plans, and getting some consultation around that with entities that may provide that knowledge and expertise so that you can strengthen the access for survivors at the shelter.
I'm also getting job readiness training, application and interview assistance, ESL training. And I think, with some of these things that we've talked about, whether it was Norma in the last scenario or, this scenario, I think another aspect is for some of these things like job readiness training or ESL training, there's often a transportation component getting folks there. So can you use those funds to also support, the transportation for survivors and accessing these services?
And also childcare too, right along with transportation.
I do think the thing that should be pretty evident by these scenarios and the allowable expenses we talked about earlier is this American Rescue Plan funding was meant to be extremely flexible. It was, it was also funded after the CARES Act funds, which we knew we needed more flexibility with. And so we had some really strong advocates at OFIPS who really helped support the flexibility of these funds for grantees. Right, maybe hop on to the next scenario.
That sounds good. This is Drew again. As survivors exit domestic violence shelters and move into their own home, some survivors have expressed frustration that move-in costs can be pricey, especially now since the rental housing market has remained high even after the peak of the COVID-19 pandemic. What are some ways that ARP funds can help set up survivors for success when they are able to move into their own home?
We had one participant name that there's just so much that can be covered. Give us a couple, give us a few.
Hi, my name is Joseph Yanez. I work with the Kauai Consortium. I apologize, my camera's not working, but we've utilized these funds to help with like security deposits, helping with utility setup fees. Gosh, I think we've even done like a washer or a refrigerator. I can't recall if it was with this pot of money or not, but yeah, just furnishings that might be a necessity, bedding, things like that. So.
Thank you, Joseph, and thank you for coming off mute and sharing. And you had a fellow participant echo some of the things that you mentioned: furnishings, appliances, moving expenses.
You can also use it for application fees. A lot of the times it's really heavy when people are applying for, trying to get into a unit and you have different application fees that they need assistance. So you can help with that as well. Groceries, hygiene, everything that is needed to get them on their way for safety.
Yeah, I'm getting a lot of responses that share a lot of the same things. We've had some folks say starter furniture and housing supplies, dishes, cleaning supplies, etc. Paying for the deposit and first month's rent, startup install fees for internet, electricity, water. Someone echoed internet setup, moving companies, furniture. Kim, with her great ideas, said get a 6-month prepaid cell phone plan and basic phone so they have access to respond to requests, appointments, etc. Paying for a moving van or storage unit to keep their belongings that they can't keep in shelter. I think even, some of those things that once a survivor is in the house and maybe a lot of their attention turns towards the cost to maintain the home and provide food and whatnot. Some of these ARP funds can even be used for legal services, medical services, medical advocacy, I should say. And so if maybe somebody was navigating some difficulty in custody for their child, and now they've stabilized in housing and they're trying to work some of that out. There is legal services and other advocacy is in the list of allowable uses for these funds. So again, there might be ways that aren't directly related to housing, but that are related to maintaining someone's stability to stay within that housing. Someone said, for those who, I'm sorry, Sheena, for those who have not heard of the washer story, pay for a used washer dryer so they are not having to go to laundromat where they could be more exposed.
Thank you, Brittany. I'm familiar with the washer story where I forget which particular coalition it is. I believe it was out of Karen Transcott, Washington State. Okay. Where the survivor, essentially the advocate asked the survivor basically what was it that they needed. And the survivor named that it was a washer that they needed for the partner to essentially, minimize the violence that was happening in their home, essentially. So it is a very powerful story if you ever have the opportunity to hear it. We also had a participant share that they had paid for nursery setup. Oh, it looks like our wonderful Patty Bronco from NRCDV maybe shared the washing machine story, or washer story, so we can share that with you all if you'd like to see it. But someone has helped with nursery setup, and that's a very innovative way. We know the intersection between maternal health and domestic and sexual violence, so that's helpful as far as safe housing. Legal fees for closing on a home. We know that legal advocacy and assistance is a allowable cost. So a lot of great ideas rolling in. Thank you all. Thank you for your sharing. Okay. How are we
Sheena,
looking?
I had one quick addition. Just to keep in mind that, you know, everybody's situation is different when they walk through the door. There is not one, you know, same type of domestic violence situation. So with that being said, needs will be different. I know, especially in tribal communities where needs are definitely different due to how rural our communities are. So just keep that in mind. And sometimes, you know, survivors often don't share what their needs are. So, you know, this grant, I was already mentioned about how broad it is for allowable activities, but just keeping in mind that there you're going to find some unique situations. And if you are unsure if that unique need is allowable, just reach out to your program specialist. They should be able to assist with that, or you can reach out to us. So I just wanted to make that point really quickly, Sheena.
Thank you, Clarice. That is always such a critically important point of survivors living multifaceted lives and having multifaceted experiences. So I appreciate you for naming that in this space. Okay, how we look on time, and do we want to go to the next scenario, or should we pause and open things up? Following your leadership, Drew.
This is Drew speaking. That was the last scenario. So we made it through all of them. The next section, we can hold some space for some questions, things that may have come up in people's mind for some of the scenarios that we've already discussed, or independently generated questions from our discussion. This is the time to pose those to our experts here.
I did want to mention, just because I want to honor this participant, someone had put this in the Q&A, and I'm sorry to bring us back a few slides. You don't have to move the slides, Drew. But someone said for the Norma scenario, if she was married at a young age and her husband filed taxes, she should have a social security card that he may have used to claim her on his taxes. She should be able to determine if this happened or not. She may be at the age where it wasn't required for the parents to get a child a social security number within the first year. So I just wanted to acknowledge that participant and thank you for your offering. What other questions do folks have? Something that, I am wondering for participants, if you don't have any questions, is any particular challenges you may have experienced in spending these funds, and any, you know, maybe creative ways that you navigated that, just again, since you have peers on the line. There are no questions. I might also, you know, hope that we adequately answered all the questions that came up through the rest of the presentation. Something that we perhaps haven't talked as much in this conversation, and this was a part of the ARP funding as well, was the funding for domestic violence and sexual assault survivors from culturally specific communities. We know that funding went out to support survivors. And so wondering if folks have any thoughts about cultural aspects and needs and in the spending of these funds as well.
Yeah, added to that too, Brittany, I was thinking a lot of the funds were spent on wellness activities, both for staff and for survivors, people that are coming into shelter, that they have access to wellness activities. As we know, that was the pandemic was really a such an overwhelming and troubling time, especially in tribal communities, given the lack of access issues that I mentioned earlier. And so it was really important that, we've seen a lot of wellness and well-being activities take place since then. And I think that's all been really good. Those are something that we certainly carry forward. Another thing I think is emergency preparedness. During a pandemic, I think that was another lesson that was kind of learned throughout COVID-19 is how we need to be prepared for things like this. And, offices closing, resources, shutting down. And there's just a number of things that happened. And, how do we respond the next time based on what we learned this time?
This is Sheena speaking. I know one of the ways that we have utilized the funds and thinking about as we are convening meetings with people just taking it a bit out of the realm of direct survivor housing use, but thinking organizationally, we've used the funds to purchase things such as those air purifiers so that when we are in meeting spaces with partners in person or having large gatherings, we can situate those around the room as a mechanism of prevention as well, or mitigating.
Just to connect your thought, Sheena, to Clarice, who was the one mentioning the importance of cultural aspects and needs. There was a really great, and I'll try to find it and put it into the chat, but there was this really wonderfully comprehensive guide for Native Hawaiians that really expressed the importance of gathering for us culturally, but it offered all sorts of ideas for mitigating the spread of COVID within that framework of we're a community who finds it very important to gather. This is what it provides for us, spiritually or in terms of our wellness. But, from this lens of how do we also, support and protect our public health, knowing some of the disparities in terms of what the impact of COVID has been, across communities of color. I'll try to find that and put that in the chat. I do think if folks are feeling, complete within themselves, I think we can, start to close out. So we just want to encourage you folks to stay connected with us. Here's our contact information. If you want to reach out for any additional technical assistance support, you can reach out to us directly at housing@nrcdv.org. You can also find us on Facebook and Instagram. Gwen, if you want to share the stars at where we can find stars on social media in the chat, I'll also try to put that in there as well. Our next slide. This is just our grant disclaimer. STARS and NRCDV, we're sibling technical assistance providers funded by OFIPS, though this presentation does not necessarily represent the views of HHS. And next slide. And lastly, we just want to really thank you folks for being here. And we want to encourage you folks, if you can, to please complete the survey from today's web event. Like I mentioned at the top of the hour, we are always trying to improve and, really want to know what you folks need and want from us moving forward. So thank you all so much for joining us. We also have a new website, so please visit us over at safehousingpartnerships.org. Got a lot of resources there, including the ARP infographic that we shared with you folks. If I can't catch you before you log off, I'll try to find that that COVID guide that I mentioned, and we can share it in the follow-up materials.
Brittany, we had one request if we could send the survey over as a link.
Absolutely, yes, I have that, and so give me 1 second. I just got too many windows, y'all. 1 second. Right here. So thank you all so much, and thank you to Gwen and Clarice and everybody from STARS who joined us today, and a big thank you to our interpretation team, our ASL interpreters, as well as our Spanish language interpreters, Joy, Missy, Irwing, and Feliz. Thank you so much.
Thank you all.
Thank you,
Take good care of
everyone.
everybody.
Bye-bye.